You don't wish you're sick, but if you're gonna be sick, I just wish I had something that everybody knew. Living with chronic pain, your entire life shifts. Everything changes. The things that you would normally be able to do, whether it's vacuuming your floors or going for a walk or taking the dogs out or doing a flight of stairs, everything changes. I would get these weird muscle spasms. Each day they were getting longer and longer and longer, to the point where the spasms were actually going on for hours at a time, up to 26 hours in an episode, and I would be awake through the whole thing. So they had a lot of doctors lined up for me. I was seeing specialists, and you name the hospitals, I've been there. Out of a year and a half, I spent 26 weeks in the hospital. I was on IV antibiotics. I had 2 episodes of cardiac arrest, and I was in the thick of it.
When you're seeing a patient like Sally, it's hard to have a diagnosis for the physician to treat.
I remember Dr. Sufi coming in and saying, I want to try something called IVIG treatment. It's got great effects and benefits if it works. Let's try it. It was amazing for me to just meet somebody who came in and said, I don't know what's going on here, but let's try something. And he listened to me.
This is so rewarding. You know, we go through our practice of medicine every day, and it's a stressful job. So it is cases like Sally that will keep you going. It's very rewarding to see that.
It was like I had these chains and locks on me, and he came along and just unlocked it. Instead of doing nothing and treating just the symptoms, let's try and get to the cause of this thing and see what we can do. I think of all the little things I can do now that I couldn't do before. It's amazing for me to even be able to take my dogs for a walk. I feel pretty lucky for that.
To be out of control from the things around me, you know, not be able to care for my family or tend to the things that I needed to, it broke me inside. It really did. We actually got military orders to evacuate out of here. We got close to Orlando. It was in the Claremont area. It was about 1 o'clock in the morning when we noticed the young lady who had either crashed or spun out or whatever, and flagged us down to stop and help her. Walking towards her car was the last thing I remember. After that, I woke up in the hospital.
I remember it specifically. Corey and his spouse came in. I believe she came in first and he came in right after. They were in bays 4 and 5.
According to the police report, there was a third-party member who was driving southbound on the turnpike. He hit me directly, and I flew about 200 feet away. He hit our vehicle, which pinned my wife in between the guardrail and the vehicle. My son Jackson, he received a traumatic brain injury from the wreck. He had multiple brain bleeds. He was admitted to Arnold Palmer. He was in PICU for 1 month. I would say from the very beginning, when they put my wife and I in the same ICU room to where we could be together. They tended to our needs. When I was able to walk even more, they allowed me to go over to Arnold Palmer to see my child while he was in PICU. Basically anything I needed that was within reach, they would help me get it done.
Our job is a little different than most other physicians. We get very little time if we're in a trauma to connect with the individual. Many times they don't even know who you are. But it's always satisfying knowing that you've actually, helped them or saved their life or gotten them through basically the worst day of their life.
To the whole staff, I hope you see this video because I never got a chance to thank you. I thank you for letting me be here with my family today. And for my son and my wife to be here today.
I think when we suffer and when we have pain, we can react one of 2 ways. We can react with fear, we can react with anger, we can retreat and be bitter, or we can choose to find the goodness in these tough situations. To find out when you are pregnant, oh my goodness, it's something that I think I can never replace with anything else. We got a phone call from my doctor, and she said that pathology came back that it was in fact a molar pregnancy. Basically a big mass of tissue forms.
I think that's always been a real bright spot in my career, to have a patient with the potential of losing their fertility, to be able to help them regain that. I don't know if there's really anything better other than saving someone's life in the midst of a crisis.
Dr. Shimp, she told me in one of our first visits, you're gonna be okay. I want you to know that I believe that I'm gonna be able to allow you to have another child. I so badly wanted to believe her. I so badly wanted to trust her.
The storm may be approaching us, but we can battle it and we can get through it, and we can do it even sometimes laughing.
It was 3 years later that we welcomed a baby boy, Brooks. Just saying his name. Brooks is wonderful. He is 6.5 and a huge ball of energy.
If I had a chance to meet Brooks, I'm pretty confident that I would look at a young boy and go, wow, he's just beautiful and perfect probably in every way, as his mother is the same.
I just don't know that there's enough words to thank her for what she's brought me. There's so many elements to how that experience has refined me, and she's such a part of that. And I am so grateful, and thank you seems so little for what she's given back to me.